Hello and welcome to VMC. I'm Dr. M. Nice to see you back, and if you're new here, please subscribe. We are going to dive into dental disease, what it is, and once we do have dental disease formed, the steps that can be taken in order to treat that dental disease. Join me. I hope you'll learn something today. Let's first talk about what dental disease is. There are 4 stages with how we define dental disease, stages 1 through 4. With stage 1, if your veterinarian is able to scale and polish under anesthesia, we'll talk about that in a minute more, the pet's teeth, then all the teeth should be able to be saved. If we are at stage 2, then we're getting some loss of the bone around the tooth, less than 25%. And at stage 2, with a bit of intensive work, those teeth can also usually be saved. When we get up into stages 3 and 4, they require a lot of intensive work, and it is unlikely that the tooth will be able to be saved. At that point, we are considering things like root canals or extractions in order to return that pet to being pain-free. I will go into the actual dental procedure more later. For now, let's talk about how the dental disease develops. So every time animals eat, they are getting some pieces of food that remain in the mouth. There's also a lot of healthy bacteria that live in the mouth. This is very normal. However, that bacteria and food can form what's called a biofilm over the teeth. And some people might refer to that feeling as being a bit fuzzy on the tooth, but that biofilm starts to form within 24 hours. And after it has formed, then it will harden into what we call plaque or tartar. If you have plaque or tartar, the only way to remove it is with a professional using an ultrasonic scaler or hand scaling under anesthesia to get below the gum line, because there is a gum pocket all around all the teeth in your pet's mouth, and there are healthy and normal sizes to those pockets. If they get too deep, that's when we start having concerns about whether the tooth can be saved or not. That plaque and tartar likes to sit under the gum line where you can't see it, and this is why seeing your veterinarian for dental procedures is very important, because we don't even know what's fully there until the intraoral x-rays have been taken of the whole mouth and we've been able to measure all the pockets around the teeth, and then we can make appropriate treatment plans from there. So you say, okay, well, we can't necessarily see the dental disease. What other clues can I have that something is bugging my pet's mouth? Well, halitosis or bad breath is a huge sign. Healthy dog and cat mouths have a minimal smell to no smell. And if you start noticing doggy breath, there are a few things it could be, but one of the most common is dental disease that needs to be treated. You might also notice that your dog or cat is doing some funny motions with their tongue. They might be only wanting to chew on one side of the mouth over the other. They might be dropping crumbs while they're eating. They might be doing some licking of their lips. They might be hesitating before chewing on things. They might be having some salivation. You might see swelling. You could see red gums. You could see actual plaque or tartar on the crown, the visible part of the tooth. They start chewing less and swallowing kibble whole, where before they would have been chewing it. All of those things are signs of dental disease, and it means that you should be discussing with your veterinarian what the next appropriate steps are for your pet, because we know that dental disease causes a lot of pain. I mean, if you've ever had a sore tooth or an infected tooth or a broken tooth, you know how painful it is, and we shouldn't be leaving our pets in pain. Dealing with dental disease promptly is incredibly important, not only because of the pain and the quality of life and welfare issues that are associated with that chronic pain, but also because the bacteria can get into the bloodstream of the pet and travel throughout the body of your pet, and it likes to most commonly travel to areas like the heart and the kidneys, and it can actually start causing issues with the function of those organs, and this can reduce the lifespan of your pet dramatically and make your pet quite ill and further hurt their quality of life. So you have now probably realized if your pet does have dental disease, and if so, you need to be asking your veterinarian some questions the next time that you see them. You should be asking them what sort of tests are going to be done before your pet has their dental procedure. I would expect there to be a blood work panel. If there are any other concerns with your pet, there might also be some imaging of, say, the heart to check on its function if that's needed. It's not necessary for all pets, but it might be recommended. Then you should also be asking your veterinarian who monitors the animal while they are under anesthesia for their dental. There should be a veterinary nurse who monitors the anesthesia, and they should be checking things like oxygen levels, heart rate, breathing rate, and if the pet is in a comfortable, even plane of anesthesia. You should also ask about intravenous fluids. Your pet should have a catheter placed and should have fluids going. That way it will help to keep them hydrated, help keep their blood pressure appropriate, and in the rare event that something goes in an unexpected way, you already have vein access, which can be critically important in the event of an emergency. Those emergencies are rare. Anesthesia is so incredibly safe, much safer than it was, say, even 20 years ago. You should also make sure that your vet clinic has the ability to do the x-rays inside of the mouth. As we talked about, approximately half of the dental disease that your pet has, you can't even see because it's below the gum line, affecting the tooth root. And so you have to take x-rays of every single tooth in that mouth in order to assess if it's healthy, if it's not, what the treatment options are, and whether it's likely to cause pain or problems in the future that we might need to recheck within a certain time frame. So those intraoral x-rays are a must. If your vet clinic does not yet have them, you need to go somewhere else that does, because without those x-rays, we can't properly treat a pet's dental disease. It's not possible because we just don't know what we can't see, and so you're going to miss a lot of issues, and those issues are going to be causing your pet pain. So make sure that you find a clinic that has intraoral x-rays. The other thing that you can discuss with your veterinarian is what sorts of dental procedures they are comfortable doing and what they do a lot of. Of course, with all veterinarians, we are going to have different skills in different areas. You should also ask your veterinarian before you schedule the dental appointment to make sure that they do intubate your pet. We need to have that airway protected because we're putting, some flesh and water and things in the mouth. There could also be some bleeding, of course, and so we need to have that airway protected. It's very important that the pet is intubated. You should also make sure that the veterinarian is the one who is doing the extractions. They do have a bit more training, and that can be incredibly helpful and necessary for when extracting the teeth. And it's also good to have a very open conversation about any potential complications that could be expected. You might get a phone call from your veterinarian partway through a procedure saying, hey, we found some stuff we didn't expect. They might talk to you about whether they wish to tackle it themselves and the risks of doing that, or if you should be referred to a veterinary dentist and have a second appointment, later down the road. We do also sometimes stage the mouths. So the longer an anesthesia time is, the harder it can be on that pet recovery-wise. So you may have a case where your veterinarian treats, say, half the mouth at one visit, and then a month later, once this side has had a chance to heal, then we can go back and do the other side. That way it can be a bit easier on your pet recovery-wise and not such a long procedure. There are also veterinarians who have done a lot of advanced training in oral health for our pets, and so there are veterinary dental specialists. And if you are looking for things like root canals, or if there's a complicated mass or tumor in your pet's mouth, or there's been trauma to the mouth, or the dental disease is going to be pretty complicated to treat, I would recommend finding your nearest veterinary dentist and going to them. They are more skilled at this, and as a result, they will be faster at it and be able to offer more treatment options. All of those things are good for your pet. So when it's a complicated issue, or if your personal veterinarian does not have x-rays inside of the mouth, then you need to go to a veterinary dentist who can help you out with your pet's dental health. They are amazingly skilled at what they do. Thank you so much for joining me today as we talk about dental health. I would love for you to comment down below with any questions you might have, anything that wasn't clear, or anything that you might want some more information on. Feel free to share this video and subscribe if you haven't already. I really appreciate hearing from you. Oh, please also comment if you have any future ideas for topics that you would like me to cover. I'm trying to get to the things that people have asked for first, and so if you have anything that you have questions about, comment it down below, let me know, and I'll add it to the list for future videos. All right, join me for part 2 of this series, and I look forward to seeing you then. Bye!